So I was educated late in improvement and implementation. I was a surgeon for many years, a dentist and then a surgeon, and nobody had really taught me that there was a change theory. There was a way of doing things in human systems. So I came to it quite late, which was a mistake. I think we should probably learn it in nursery school, never mind at professional school. And I was taught quite early on that there were three things you needed for change. There was the will to change, in the people who are going to do the change and in the leaders who lead that change. You needed ideas, so you needed the recipe, whatever it might be it for criminal justice or for healthcare in my setting. And then the third and crucial element, what they called in that framework, execution. You can substitute implementation in there if you like, or improvement. And that's the piece I think that we have lacked in most human system change for decades, maybe even longer. And that's the bit I learned most about, that execution piece of the theory. If you're going to spend the 15 billion on health spend in Scotland, or whatever your budget is for your piece, you have to use that as wisely as you can, which is why we talk about a triple aim, three aims: best care, best provision, whatever. It could be literacy, it could be health and social care. Best population care, so that's at a broader level. So how are we going to do vaccination? How are we going to do poverty? How are we going to bring the society upwards? And then the third piece of that aim is best value for money. And you can't do the others if you don't concentrate on money. You can't, most workers don't like starting with the money conversation, but you have to have it. Because if you're going to spend particularly public money wisely, you have to have a conversation about value for money inside that. And is it value for money to spend that on early years, or should we be making choices somewhere in criminal justice? So there are societal decisions to make, no matter which country you're from, about how you adjust that spend. In the end, each pound, dollar, euro has to be spent wisely, and improvement and implementation science help us do that, because your change theory is going to make it better, and therefore you'll get better bang for your buck, for the cliche. We know that you need an aim and a purpose to get you out of bed and to focus on whatever your work is. We know we need to measure what that success might look like, and then we need a method for implementation. And at some level, I don't really care what your method is, but you need to be able to articulate it, and you need to be able to measure success towards it. And if your method is correct, your number will move. If your method isn't, you should probably think about changing it. So when people come to me with alternative change theories, I used to argue and fight and be annoying. Now I'm very, very comfortable with alternative change theories. I just ask them to bring their outcomes. So what have you done with that change theory that has led to the betterment of those children in that environment, or that set of incarcerated men, or whatever it is you're trying to improve? So the ability to have a method inside there seems to me to be the crucial lesson from Deming and from others. So improvement has been in the background, I think, for a long, long time, and people have spontaneously done it without really being able to articulate that it was Deming or this clever theory that people have worked out in universities. But when you actually study it, and when you put people through courses of implementation or improvement, their eyes brighten, because it's kind of what they've always known to be true. They haven't been able to articulate it. And then you reach a critical mass, I think, in a sector, or even in Scotland, I think potentially maybe even in a country, where you reach enough people who have understanding of the measurement theory, understanding of small cycle testing, implementation testing, that suddenly when somebody brings a problem, they say, well, have you tested in a small community? Have you? So we have cabinet ministers in this country now who can draw driver diagrams and ask for measurement over time. That seems to me to be quite a moment where your Minister for Justice or your Minister for Health would say, no, bring me that measurement over time. I don't believe in that red, amber, green thing. That doesn't work for me anymore. The First Minister can ask cabinet ministers for driver diagrams and aims and measures. So I don't think many countries in the world have cabinets who can do that. So it seems to me that in Scotland we've reached a mass of people who are educated at least in this language and this way of working, and they've begun to see results. And nothing moves a set of leaders like results can move it. And that's, I think, what we've got to show. So there are alternative change theories in the world. So we sometimes get accused of being, the implementation world, get accused of being a bit slow, because what we do isn't a silver bullet. It doesn't improve things on Tuesday. It takes time. So alternative change theories are available. They are around performance management. They are around writing letters. They are around simple sending guidelines out to people. So those are available. So unless we form a community of practice that is coherent, is evidence-based, is research-driven and the foundations are research-based, then we will be replaced by less adequate change theories, because my reading of the literature, the experience we've had in Scotland, would suggest that implementation and improvement science in its broadest sense is the only way to move the human system in the way we wish it to move. So we have to therefore have a community of practice for that. There have been cardiology conferences forever. My surgical specialty meets every year at the big surgical conference, because that's the way humans interact, both for content and for networking. So what better idea could we have than the ability to implement change? And that's why implementation conferences, this one, others, are crucial to move that society piece forward.